on the side of for let's say men to get better, and this is a question I've had with other folks as well and other veterans, it feels to me like the actual system is not geared, and I'm going to say for veteran men, to get better, because we haven't experienced. A lot of us are more, you want to call us like more type A, maybe more alpha male, maybe more prone to wanting to act and do stuff and be aggressive, but in a good way. But it seems like that side is not really encouraged as part of the mental health kind of healing model. Is there anything to that, or am I just taking a wild stab at it and just seeing what I see, and maybe it doesn't apply to anybody else except me and a few other guys?
What you said converges actually with a lot of the research evidence. So the research evidence shows that men in general, but especially veterans, prefer kind of action-oriented modalities of healing compared to talk-directed modality of healings. So what that means is a bit of a mouthful of a phrase, but like a modality of healing, we recognize that there are very different ways that individuals can heal. And we know that from cultural psychiatry. We would never try and impose a Western way of healing on an Aboriginal community. We would now consider that to be unfair and possibly ineffective. But we need to recognize that there are very diverse modalities of healing. And when there are people who have conducted surveys or looked at differences between men and women, and just broad statistical differences, obviously it's not predictive for every individual, that men like to be involved in some kind of action. So if you think about maybe, before there was a mental health system, or people who don't live where there is a mental health system, if there's a young man like having some troubles or wrestling with some issues, a typical thing might be, let's take the guy fishing with one of the older elders from the village, and that you're sitting shoulder to shoulder, you're fishing. Another thing we know, like hunting is used by Aboriginal communities to like try and reinsert young men who are having troubles, saying, look, we're going to teach you some new skills. You're going to come out with the elders. You're going to do something useful, which is then going to help us feed our families and feed our community. And that's another thing we see in men's mental health and with veterans, that they don't really like being kind of passive recipients of care. They like to be involved doing something, helping others, helping themselves by helping others. So some of the more exciting new research shows that wilderness-based interventions are actually very good for men's mental health and veterans' mental health. So you're smiling, you know what this means, getting some men who are having issues out into the wilderness, hunting, fishing, making fires, making shelters. The more experienced men maybe helping the less experienced men. And every man brings something to the table. Maybe a man who's good at fishing is not so good at map reading, whereas someone who's good at map reading is not so good at fishing, or someone who can start a fire from scratch. Someone's better at cooking. And the idea is everybody's helping each other. And in that process, people are being helped themselves.
Right.
So we have a phrase in men's mental health now that men heal shoulder to shoulder rather than face to face. What that means is that shoulder to shoulder activities, exactly as you just said, David, I just wrote it down actually, a walking based activity where men are walking along shoulder to shoulder. You're doing something, you feel good, your endorphins are being released, and you're getting to know and trust people. And that might lead you to disclose mental health issues and get some helpful feedback. Like I said, fishing, even like driving in a car. We know, sometimes a dad will take his son, or people go out for a drive and they'll talk about things. Hunting is a shoulder to shoulder activity. So one of my big missions at the moment is really trying to spread the word about the importance of shoulder to shoulder healing. And people shouldn't feel bad or feel shamed if they don't want to see a psychologist or a psychiatrist and don't want to sit face to face and talk from day one about their innermost thoughts and worries to a well-meaning and well-trained person, but who is a stranger and might not, like you say, understand you as a man or as a veteran. There are lots of amazing veteran peer support groups across the whole country. I mean, you just talked about your walking group. You run one, kind of. They're also very good venues for that kind of healing and for that kind of support, which veterans are looking for. So, yeah, we do need to get away from the like one size fits all idea that mental health issues can be cured by medication and by talking therapies, that they certainly should be options. People should think if they want them, but there's all this stuff happening in civil society is really helpful for men's mental health and for the mental health of veterans. But sadly, they're often on a shoestring budget, if they have a budget at all, and they're being run by volunteers like you.
Yeah.
And one thing I always say is maybe the government should give kind of block grants to the community groups, that might be a better investment than just throwing money into big hospitals, which is a bit like a leaky bucket. The more money you throw in, the more it seems to evaporate.
Precisely. Right, exactly. Because I mean, their bureaucracies are so big, right? Like they have so many layers of bureaucracy over layers of and everybody's got to take their cut. And